Hello, everyone, and welcome back to the Lube Tube. This is episode 12. It's titled STDs, Spreading the Knowledge, Not the Germs.
Germs.
Ew. I think it's important that we talk about this because, as you very well know, we were at a really good birthday celebration this last weekend with a bunch of girls. And there were a lot of questions that we got about this. And everybody was like, hey, y'all should really do an episode on the difference between all of them and what's considered an STD versus what's not considered an STD. So Brittany and I thought it'd be a good idea to go ahead and educate, right?
Absolutely. And for those who may not know, well, first of all, I'm Brittany. I didn't even introduce myself this time.
Oh, I didn't either. Hey, I'm Jeanette.
No, you already said your name.
Oh, I did?
I think so. I usually lead with that. So this weekend we went to Round Top and we had a wonderful time and with a group of special ladies. And yes, this did come up at some point.
So basically, we're going to educate you on how they're spread, why awareness is important, why it's important to have these non-judgmental conversations, not just with your doctor or your PA or your nurse practitioner, but also with your partner, right? And how important that is to have these discussions prior to intercourse, because this is how easily they're spread. And these are definitely something that can be prevented. So I thought it'd be a good idea to jump right in and kind of just educate you all. So brief overview of kind of STDs, basically the different infections that we can get through sexual transmission. And these can be viruses, they can be bacteria, they can be all sorts of different infections. And we're going to talk about each of them differently and how they are spread and how they're treated independently. So I think it's important that this is going to be a judgment-free, fact-based discussion. Brittany, I'm not going to ask you if you've ever had an STD, and you're not going to ask me that either, right?
Nope.
I love it.
Although apparently I need to start answering questions because I keep getting feedback that when I don't answer questions, it's essentially me saying yes. So I need to.
You heard that this weekend that these girls were like, well, Brittany, when you don't answer the question, we know you've answered the question. So yeah, so I'm pretty much positive that everybody thinks you squirt.
Oh my God. For clarity, I do not think I have, but it's still up for debate. So again, I'm going to answer questions in their entirety from now on. I also want to clear something up in the very beginning because I think it's important. Mm-hmm. STD and STI can be used interchangeably. I feel like I don't know what happened, but there's a little confusion around that, and they are the same thing. It's just what verbiage you prefer.
Well, I think when we were younger, they were just STDs, right? Sexually transmitted disease. And then I think there was that was kind of condescending and people didn't like the idea of disease. So they changed it to infection because it sounds a little more promising when you say I had an infection, because we feel like we can treat that. Where if you say I had a disease, those aren't as easily treated. So I think that's why that got changed around.
Yeah. Thank you for that clarity.
Yes. So common STD/STIs, there's chlamydia, there's gonorrhea, there is HPV, there's herpes, there's syphilis, there's HIV, there's hepatitis. Gosh, I could just keep going.
I know, stop there.
Okay. And last but not least, there's trichomonas. Trick. And so basically, there's difference between bacteria versus viral STDs. Some and most bacterial STDs can be treated with antibiotics, where the other ones, the viral cause, are not always easily treated. And the hard part about a viral STD is that just because we make it go away once doesn't mean it's not hanging around and staying in the system, right? A great example of this would be HPV, human papillomavirus. It doesn't have a treatment, but it can go unfound for a very long time. And so another example would be the herpes simplex virus, both 1 and 2. So herpes simplex 1 used to be found only around the oral mucosa, meaning around the mouth. And then herpes simplex virus 2 used to be found only around the genitalia. But now that there is so much oral sex, they have now been interchangeably found in those different areas. So herpes simplex 1 is now found on the vagina, vulva, and penile area. And now herpes virus simplex 2 has now also been found around the mouth or area, all basically due to oral intercourse.
This is what we call evolution, Jeanette.
Right?
Evolution.
These little viruses are changing.
I think that is confusing too for people too. Like, oh, I don't have the bad herpes.
I know, they're all the same. They're all the same. And that's the also very frustrating thing about herpes is once you have herpes, it's not necessarily going to go away. It's just going to basically we can keep it where it doesn't, I don't know, cause the rash and the pain and the irritation that you get in those areas. So herpes simplex virus can also be just a simple cold sore, right? So a simple cold sore on the lip, if your partner has that and y'all have just literally a kiss or maybe even oral sex, that herpes simplex virus ulcer can then be spread to the genitalia during oral sex. So that's commonly how 1 became 2 and 2 became 1. So really, they're treated the same way. They're both treated with antivirals, and those medications include medications like acyclovir. You probably have heard of that, or valcyclovir, also known as Valtrex. So these viruses, although we can't make them go away completely, we can a lot of times make the rash go away. And we can also take a daily medication, which are one of the 2 that I just recently mentioned. And those can actually prevent rash or that irritation that can occur.
Yeah. So in regards to how we have such a easy spread at times, I think people think I have to have sex for this to happen. And
Right.
as you mentioned, that is certainly not the case. Granted, sexual contact is certainly attributes to a lot of the spread of STDs, but what are the other ways they can be spread?
Yeah. So say you have a cold sore, right? And you have an active cold sore and you were to drink out of a straw and then your friend or partner, or maybe even your child was to drink after you out of that cold sore, you can actually spread that, or using somebody's chapstick can also spread that herpes simplex virus. So maybe they wouldn't obviously get it on their genitalia because they're not putting the straw on their vagina. I hope.
Well, that would be cute. Oh.
But you can
never say never, Jeanette.
Okay. I don't know what you do in your free time, but most of the time
you
you're
do
not
actually, but that's okay.
You know what you do in your free time. But most of the time, you're going to spread that oral lesion to another oral area due to just using somebody else's chapstick or straw.
Now, obviously, there's also ways where you can have it on your genitalia and spread via skin to skin.
For sure.
Right?
Yes.
That's something that I think more people are scared of that than of the oral happening via the oral spread. Like we were conditioned to think, oh, okay, if someone has active lesions and I have sex with this person, that's how I'm going to get herpes. But a lot of times, most of the time, it's not the case.
I know. And the other big thing that I really want to stress here is, yeah, herpes sucks, right? I don't want anybody to have herpes, but herpes is so popular. Is that the word I should use?
Prevalent.
Prevalent. That's
I actually have a statistic. You want to hear it?
Yeah.
Yeah. So Johns Hopkins says that 1 out of 6 people in the United States
that doesn't
herpes. And I believe the age range was from 14 to 49. But wow. Even people older than that are getting it. Because as you know, part of my my other job is I work in some rehab long-term care facilities.
Right.
Luckily, it has not happened in my facility, but there was a big outbreak of herpes in the long-term care facilities. Certain ones, I don't remember when this happened, but fairly recently. And I think it's not an isolated incident. So,
yeah. You think these older people are getting busy?
Oh, girl, are you kidding? There's no question.
I love it.
No, that is a huge problem in nursing homes. I had very recently I had that issue, not the spread of herpes, but there's just like hypersexuality is actually a big thing with elderly.
Oh,
yeah.
something I didn't know that.
Yes.
Love it. You know, that's the thing though, is like, it's so prevalent. In fact, I would have thought it was more than 1 in 6, to be perfectly honest, because I see so much of it all day long. But I have so many people that are fearful to start maybe a new relationship or a new sexual relationship because they're afraid of getting herpes. And that's the part where I'm like, oh, I don't want you to feel that way, right? I don't want you to be worried about sex. I don't want you to be fearful of having sex with a new partner because of your fear of getting herpes. Because although it can be very uncomfortable and although it can be very painful, especially with your very first outbreak, this is one of those things that a lot of times people have it and they don't even know they have it, right? Because they've never had an outbreak. Because your body is so good at like actually having the virus and it holding it, basically in silence. And then when your immune system goes down, or maybe you have you're in the sun too long, or you have this infection that's bringing your other part of your immune system down, it will actually rear its ugly head. And that's when you become symptomatic of having like the rash or the painful irritation in the vulva area, or even on the penile area, or even on the mouth. But like I tell my patients, I was like, well, don't stop a relationship just because you're fearful of that, or don't progress to the sexual part of the relationship because you're fearful of that, because that's what these medications are for, right? Valcyclovir does a very good job of actually stopping the virus from replicating, meaning making more virus, which can shorten your amount of days of symptoms, right? Which can do a really good job. But like I mentioned before, it's not going to kill the virus and make the virus go away. It's going to stop it from keep making more, which then lessens your symptoms and can hopefully prevent future outbreaks.
Do you remember what you told me when I was actively dating
Mhm.
on the on the apps, which
Oh, yeah,
oh God, like
I know.
horrendous. And I was explaining to you how as a medical professional, and I think just even as a woman, just in general, you go into these, first dates, second dates, and you're like, okay, yeah, like I like this person, but am I willing to chance it? And
Mhm.
you very frankly said to me, what are you scared of?
Yeah,
Says the lady who's been married for how many
I
years?
know. I
Yeah,
know.
you bitch.
I know.
And I said, I mean, I don't know. I feel like something like herpes is just like a very intimidating thing. And you said, Brittany, you don't worry about herpes because if you get it, I'll treat you.
I got you, babe. I will call out Valtrex in 2 seconds flat. I
And I
don't
mean,
care how
it
they
was
feel.
actually it was an eye-opening conversation with my provider slash best friend who needed to tell me like, girl, just go do it. And
Yeah.
then I do actually remember you being like, actually, I would be more scared of XYZ, even though it's treatable, it can be more, I guess, more painful, more
Yeah.
unsightly. I don't remember the word you used. I'm regardless.
So I
Um,
would actually be more afraid of things like gonorrhea and chlamydia and trichomonas, just because you're right, they cause this awful discharge in females, and they can cause you to have painful sex. And honestly, if left untreated, that's when we get ourselves in trouble, right? Because that's when it leads to something called pelvic inflammatory disease, or PID. PID is a very dangerous thing because it actually goes where the infection itself leaves the cervix and then fall and goes into the uterus and then goes into the fallopian tubes and to the ovary area. And it can actually cause abscesses on the ovaries themselves. And sometimes such a severe infection that you actually need IV antibiotics and have to be treated in the hospital for this. So that's why I was telling you that, hey, I know you're scared of herpes, but that can be easily treated and it's kind of self limiting. It also makes it kind of go away on its own. Eventually, the virus is like, okay, I'm not going to cause any more issue. And then the rash goes away and you feel better, right? Where if we leave gonorrhea, chlamydia, or trichomonas untouched, then we're stuck with possibility of infertility, right? I have some women that have lost their ability to procreate or get pregnant due to a severe pelvic inflammatory disease. So, due to these STIs, right? So, although they're easily treated, right? If you were to come to me and I did a culture and say I found chlamydia, I can easily treat that with antibiotics. But if they go untreated, that's when they can lead to further and worsen things. all three of those, both the including gonorrhea, chlamydia, and trichomonas, they're all treated with antibiotics, all oral antibiotics, all things that I can call into the pharmacy. I take that back. Gonorrhea is not treated orally. It's actually given in injection form, and it's an injection called ceftriaxone or Rocephin. And that basically, if it is found, we call in that injection, you bring it to the doctor's office, and that's where we give you your shot.
Yeah. Let's touch real quick on HPV because I
Mhm.
don't want to forget this because I feel like HPV is kind of like diabetes in the sense of you can't really feel it. You don't know what's happening in your body. You can't see it, right? It's easier when you can see things.
For
But
sure.
with HPV,
Mhm.
sometimes there's things happening with our cervix that we
Oh,
don't
no.
realize is happening. So when you come in and you see your provider and they tell you, "Hey, I need you to come back in XYZ,"
Mhm.
definitely come back because there one small thing can turn into one big thing.
I know. Especially with us as females, right? HPV, human papillomavirus, that can cause our cervix, which is the opening of the uterus, and what dilates during delivery of a baby. That can cause cervical cancer, right? And HPV is one of those viruses that has several different types, right? And there are only a certain few that cause actual cervical cancer, but there are a few that obviously that we still screen for high risk HPV. And if your doctor says off of a pap smear, hey, you've got HPV, I think it's important to know that you have no idea who gave you that HPV, right? That doesn't mean that you know, your sexual partner at this time is the one who gave you HPV. HPV could have been laying what we call latent in your body for a very long time. And then due to your immune system being down or you having a certain type of infection or you just basically some reason that HPV then comes back and actually starts causing changes on the cervix or is now being able to be found by a pap smear. And that is the most frustrating thing about HPV.
I agree.
For so long, you thought you were fine. And then you get a pap smear back that says you've got HPV now. And you're like, holy shit, is my partner cheating on me? Right.
Right.
I know
And that can, yeah,
that.
no, that can certainly cause issues with relationships. So that's a good education to know that it can definitely be dormant for, I mean, there's not like a good amount of, I can't be like, oh, well, 6 months from now,
I
this
wish
is
there
when you
was.
should expect. But this is also important to note that something like trichomonas,
Yeah.
gonorrhea,
Yeah.
these type of things are acute. So
Correct.
it's not something that happened 6 months ago. So when I get the question from a patient, hey, I just got these results.
Mm.
My husband, my wife, my girlfriend, my boyfriend, whatever, maybe they said there's nothing like that nothing's gone on. Like, how did this happen?
Yeah.
Those are hard questions to answer as a provider, right? Hard
100%.
questions.
Because the last thing I ever want to do is point fingers, right? But if you know for a fact that you have not had sex with anybody else besides that partner, and you come to me and I find gonorrhea or chlamydia or trick on your pap smear, somebody did something different, right? And so that is a conversation that is very difficult, like you just said, because I literally have to sit there and tell the lady, hey, look, this is a new infection. This isn't something you got, 6 months, a year, 2, 3, 4, 5, 10 years ago. This is something that is newly found, and there needs to be a conversation. Plus, your partner needs to be treated. So, say you get gonorrhea or chlamydia or trick, and you're like, hey, I got treated, I'm good. Well, guess what? If that partner didn't get treated and then you have sex with them again, you're just going to reinfect yourself. So that partner needs to go and get treated. Whether or not they get tested, I don't care, but they need to be treated.
Preach.
Preach. And one more thing, like going back to HPV, HPV now has a vaccine, and I know we've talked about this before, but the Gardasil vaccine can actually protect you from a couple of those different types of HPV that do cause cervical cancer. HPV is also the number one cause of genital warts, right? And these are unsightly. They are frustrating. They are one of those things also that can pop up and never have been there before. And now you've got a wart, right? That doesn't necessarily mean somebody's been cheating. You could have caught that and caught that a while ago. And now your body is now showing signs of it, right? So these are conversations that you just really have to have with your partner. And these are also conversations that you need to talk to your partner before y'all even start having sex, right? Like, hey, are you clean? Have you been tested? When's the last time you got tested? If you're single and you're coming to me, I think you should have a STD or an STI test at least once a year, right? If you get a new partner, sometimes it's a good idea to have an STD test with every partner.
Let's talk about how you actually do the testing. If someone comes in and they do want to get that testing, what are you going to do?
Okay, so if you're a female and you're coming to see me, I will take a Q-tip and I will actually swab the inner part of the vagina. I can also do inside right on the cervix. That's going to be the most accurate test. So if I do a speculum exam, I place that little Q-tip and I get a swab and I send that off. I get those results back by the next day. We use a lab that's pretty quick. As far as males, a lot of times these guys get away with a urine test, and that is so frustrating. It used to be only that they could be tested by sticking the same small Q-tip inside the head of the penis.
Oh,
Yes.
man, that sounds
Yeah.
painful.
But now they get away with peeing in a cup where we still have to have the vaginal exam. So honestly, the testing is actually better and more accurate if it's done with the actual swab. But getting men to actually get that done is pretty low.
That sounds like a double standard to me.
Yeah, I would
When
completely.
when I was in PA school, we had a lab where we learned how to do pap smears on actual, or I guess just pelvic exams on actual patients.
Yeah,
And so there was a lady there that was getting a speculum,
yeah.
put it in her multiple times, and she was actually super kind. She was telling us like what to do.
Yes,
It
and she
was
gets paid for that.
she gets paid. That's I'm sorry, but there's not enough money to pay me for that. But one of the interesting things that she said is that they had tried to get male patients to help with the prostate
Yeah.
exam, but nobody would volunteer.
Well, when I was in high school a billion years ago, yeah, we had the male patients. And do you know how many rectal exams? We had 60 people in our class. So guess how many those two guys got?
Oh, there's only two of them.
Only
Oh my
two. So
gosh.
60 of us went through that exam and gave rectal exam after rectal exam on these men.
Jesus.
I know.
That's wow. So we went over the testing that we would normally do.
Uh-huh.
Can we talk about what's maybe some prevention type things
Yeah.
to avoid as much
Yeah.
as we can?
A condom.
Mm.
That's what sucks. Yeah. The only thing that's really going to prevent spread of these STDs is a condom, right? So if we're having sex with male female sex, it's going to be a condom. Female sex, it's going to be basically making sure your partner is clean. And if y'all are using any type of toys that are intravaginal toys, these need to be cleaned and make sure that that partner doesn't have any STDs prior to sharing anything with them. So yeah, it's the only way. You know, I wish there was better ways, but that's really, it comes down to knowing your partner and your partner knowing you and trusting you and being able to say, no, I'm clean, and you trust that partner, and then y'all have safe sex.
There's also abstinence.
Oh, forgot about that one.
That's interesting that you forgot that, Jeanette.
Okay,
Wow.
we're moving on. Okay, asshole.
Okay. Well, let's also talk about the emotional part of this because I feel like there's just this stigma
Yeah.
about STDs.
Uh-huh.
And like we've talked about the prevalent, like they're highly prevalent.
Right.
You definitely have a friend who has one or who has had one.
Absolutely.
I would actually be interested to see what's the statistic on how many people have had an STD in their life.
Oh, yeah. And how many people with that STD have they told anybody about that STD?
Right, exactly. And
Yeah.
there should not be, you should not feel guilt about this.
Yeah.
I know that a lot of, I remember I had a friend who was with a new partner. They didn't really discuss anything. And then unfortunately, she ended up getting an STD. And I remember her just being so guilty, feeling so much shame about this. And
Mhm.
I'm like, girl, you like, first of all, you had no idea. He wasn't transparent.
Right.
And I mean, she was smart enough to like look and make sure things looked okay, but he was obviously actively shedding, but without showing symptoms. And there was no way to comfort her because
Right.
she she also like, I remember her saying the word, I feel dirty.
Oh, I hate that for her.
Yeah.
Something that is also important when you go to your gynecologist office, this is one of the questions that they're going to ask on a questionnaire before they even see you. Do you have any history of STDs? And it's not because we want to judge you. It's because we want to make sure that you were screened. And then if you were found to have one, that you were treated correctly, right? Because going back to that whole PID thing, right? If left untreated, they can cause major issues in female patients. So don't lie on those questionnaires. I'm sure there are patients out there that saw that and felt like if they put yes, that we were going to judge them. No, that's a completely new
Mm-mm.
judgment zone. So make sure as a female you answer that correctly too. Also, we didn't talk about the big guns, the big gun STDs that are obviously something that is not easily as treated, right? HIV, right? That's another big, big STD. And that's a virus, right? That's a virus that is spread through sexual contact, also through blood contact. And that is a bloodborne illness where the virus just you get infected and it creates more and more and more. And then HIV, we don't have as many AIDS patients, thankfully. HIV then leads to an immunocompetent disease, where also known as AIDS, where your body is not able to fight infection. So just because you have HIV doesn't mean you have AIDS. And I think that's also something that a lot of people don't understand. HIV is the actual infection, which can lead to the disease of AIDS, right? And a lot of people don't have AIDS anymore because we have such great antivirals for HIV patients. I remember when I first started in infectious disease, these patients were taking 5 to 6 medications a day in order to try to help lower their viral counts. And now some of these HIV drugs are in one pill, right? Which is so great for these patients and have a lot less side effects too. So that is also a very non talked about infection, but that is part of the screening that I do when you come and see me. I do blood tests that check for not only HIV, but also hepatitis. And hepatitis, the most common one I sexually is a hepatitis C. Okay. Hepatitis C is also a blood-borne illness where that can be sexually transmitted, but also through dirty needles with using intravenous drugs. And so these are definitely infections that I search for when I test for you and with for bloodborne pathogens. And the last one, which is actually making a huge rise that nobody's talking about, is syphilis, right?
Oh yes, neurosyphilis.
Oh,
Yikes! 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 Yikes!
that is tertiary syphilis. So now what Brittany's talking about is a syphilis that goes untreated. So primary syphilis is an infection that we get where we get this little rash basically on the outside of our vaginal area or on the penile area. And that rash, it's a painless sore that we just think is nothing. And then it goes away. And we're like, oh, I'm fine. I guess that was just like I cut myself, or that was weird. I don't know what that was. And it just basically gets left untreated. And so nobody thinks about it. And then comes this rash that some people get on the palms of their hands. They get palms of their feet. They might run a fever. And that's actually secondary syphilis. And that's where this primary syphilis was not treated. And then secondary syphilis comes along, and then boom, that gets untreated. And then what Brittany's talking about is tertiary syphilis. And that's where the syphilis has now traveled to the brain and has basically eaten away at the brain. What a freaking scary, scary infection, right?
Yeah.
And you know what's crazy about syphilis? How easily it's treated. Syphilis is treated with penicillin, like the oldest antibiotic in the books, right? Easily treated. And I just feel that it's not screened enough for. So when people go to get STD testing, they're always like, I don't want to do the blood work. And I'm like, well, you probably should do the blood work because we're testing for syphilis, which, is a very commonly spread infection that I'm seeing more and more, especially in the San Antonio area.
Oh, good thing I'm in Bernie.
Oh, shut up. Shut up.
I agree, though. I have heard that there has been a resurgence in that. So,
Yeah.
okay. So, let's move on to some frequently asked questions.
Okay. Okay.
Okay. we're just talking about testing. How often should I get tested?
I think if you're in a committed relationship where both partners are only having sex with, just each other, then I mean, I think initial testing is good. And then for each of you, and if you're good and you know that you're both committed, I don't think it's absolutely necessary. Okay. I'll be honest with you, Daryl and I've been together for a very long time, and I can't tell you the last time I was tested for STDs just because we're in a committed relationship. But somebody who comes to me that maybe is fearful that maybe their partner has not been, honest, then they come to me and they want STD testing. Sure, that's easy. That's an easy swab that I get back the next day, right? But I think it comes down to intuition. I think it comes down to also talking to your partner. And honestly, if you come to me and you have any new symptoms like vaginal discharge or itching or a weird smell that it's never been there before, or pain, right? Pain with intercourse, you're automatically going to get an STD swab if you come to me with pain with intercourse, because this is a new thing for you. I'm going to rule that out.
And if you present this to somebody and say, hey, I'd like for us to both get tested, and they get angry or they're like, why? They ain't the one. See you later, alligator. Bye.
Yes.
If anything, if someone came to me and said, hey, I think this is what we should do, I would be like, oh, like you are so proactive.
Right. Because
Like,
then that makes
also, will you fold my clothes?
Oh,
Cool. You're a winner. Will you make me dinner? Okay, great.
sold.
Do you have a trust fund? Okay, great.
Fold my clothes and put them away.
Okay, if both my partner and I are tested and we're good, does this mean we safe?
If your partner is negative and you're negative for STDs, then yes, I think y'all are totally safe to go ahead and have sex. But I think it's important that you understand that men are not tested for HPV. So if you come up positive for HPV, that doesn't mean that you got it from that guy. Okay. So men are not routinely tested for HPV. And I'll be honest, in my 17 years of practicing, I've never tested a male for HPV.
But
just because
why?
that's not something that we routinely.
But why?
It's a great question. I don't know. I don't know. I don't know the answer to that. Unless, they actually have a wart, right? Then I'll take the wart off, or, we can send that for pathology. But no, we never test for males for HPV. I also don't believe in herpes simplex virus testing that is done by blood work. And
Man,
this is a huge...
You seem very passionate about this. You can't see your face, but I see your face.
Because these women come to me and they're like, I want to be tested for herpes simplex virus. And I'm like, okay, do you have a lesion or do you have a rash? And they're like, well, no, I don't have anything right now. And the problem with testing is we're testing for antibodies, right? We're testing for antibodies, which are basically a memory cell that comes up in your body when you are around something that has an infection, right? So prime example, when COVID was a big thing, right? We were checking antibodies to see if somebody had COVID antibodies to see if they're been around COVID, right? Okay, so herpes antibodies are going to go up just if you've even been exposed. So herpes virus, so say you get a positive, that doesn't mean you have active herpes. That just means you've been exposed to it. So I can't do a herpes virus lab that checks the actual virus itself unless you have an active infection going on, like with a rash. And then with that, I'm not going to draw your blood. I'm actually just going to do a swab and send it off for culture. You know what I mean?
Yeah, I get it.
So all of these blood work, it actually just muddies the water, and it can make relationships, it can actually worsen things. So I don't usually recommend the blood work.
Yeah.
Okay.
Thank you for that, ma'am.
That's my soapbox. You're welcome.
Do you know what a soapbox actually is?
No.
Like, why do we say that let me get off my soapbox?
Do you know?
I have always imagined that back in the day, soap was carried in large boxes.
Okay.
And I don't really know. I've never looked it up. I just assumed it must have been a really big box that you had to get off of.
You know what? When you say that, I wonder if it's because the boxes that held the soap people would get up on that and talk like in a big crowd and they were upset about something and they're like, blah, blah, blah. So people could hear them. So they were on a podium basically. So people would look at them and talk about things that they were bothered by.
But why soap?
Brittany, I don't know. Now we have to find this out. You know who's like the king of knowing all this shit? Daryl.
Soapbox. We were right.
I looked it up. People used to, well, I didn't look it up. I'm going to be honest. I asked Daryl because he knows this. He knows all these little things. And I think it's kind of crazy that he knows all of that. But anyways, he also watches Mysteries at the Museum.
What?
You ever watch that show?
No.
Mysteries of the Museum. It's like they find an artifact and they talk about the artifact and they talk about what that artifact and where it came from, like dating back to however many centuries ago. And it basically tells a story and he loves that.
Cute. Remember we were talking about this weekend about Goosebumps and how they used to have Choose Your Own Adventure? I bet Daryl liked Choose Your Own Adventure books.
100%. He loved Goosebumps. I did too.
Okay, do you know what time it is?
It is Slippery Solutions with B and J.
That's the only way we can do it when we're not in the same room together is I have to wait till the very end.
Yeah.
Yeah. Are you ready?
No, actually.
Well, I just want to say that it's now started to be where I can only ask one question because people are not submitting. So please submit questions.
Oh, come on, people. You just like to hear it, but you don't want to submit your own question.
You ready?
Hey, no, but this is important. People can submit their own question on the LubeTube, our website, right? And it be completely anonymous. If they send it to our email, like through the Gmail account, they will have obviously their email on there, but they can submit their question on the podcast website, the LubeTube podcast, and it's all anonymous. So have them do that.
Okay. You heard the girl.
Okay, that.
I live with my single mom.
Okay.
She's a hot bitch.
Oh.
Lately, she has been bringing men over to the house.
Okay.
It kind of makes me uncomfortable. And sometimes I hear things I don't want to.
Oh, yeah.
Should I address this or just let my hot mom do hot girl things?
Oh, okay, mom.
Hot girl things.
Oh, man. You know, if y'all are going to live together under the same roof, I think y'all have to have this conversation. I think you have to tell her, A, that you're happy for her, that you're happy that she is having the time of her life. B, that you want to make sure she's doing it safely, right? To make sure that she is actually obviously protecting herself from everything we just talked about. And C, that, I don't know, maybe y'all can come to an agreement. I don't know, like the whole sock on the door thing, like when you were in college.
A sock on the door?
Oh, God.
That's, I don't know if we want to use socks in this equation, Jeanette. My God. This is not the 1800s. We can text. I mean,
oh, yeah, I guess you could do that.
I mean, I don't want to say that was a bad idea, but that was an interesting idea. I liked 1 and 2. 3 sock. That's like sock gate. I don't know.
You've never heard that where people used to put socks on their door to tell their roommate they're, doing hot girl things?
Like I said, in the 1800s.
Okay, bitch. I didn't go to college in the 1800s.
I like that. I do like that advice. I think that's
so
good advice. I don't think I could have said it better. So,
hey, wonderful. Yay.
Hot girl things from hot moms.
Hot girl things from hot girl mom.
Okay.
Well,
that's all I got for today. Like I said, we were limited on questions, but I liked that one. So,
okay. Well, maybe these ladies will get with it and send us some really great questions because I do enjoy this part because I don't like to read these questions. So you just come at me and I'd have no idea what we're going to talk about. And it's actually one of my favorite parts of the cast.
Oh, you're saying the cast.
Oh, it's supposed to say the pod, right?
Yeah, I've never heard it be called a cast, but that's okay. Starting new trend.
I am so fucking trendy.
Jeanette, you still use Yahoo, remember?
Okay,
There's nothing
whatever.
trendy about that.
Whatever, Brittany.
Okay. All right, so let's just bring it all together.
Okay.
We at this point I feel like we've gone over a lot of the STDs that we all hear about,
Yeah.
how to get tested,
Right.
how they're treated. We're
Right.
trying to take away the stigma of just STDs altogether because they really are so prevalent. And we just want everyone to know that as providers, we're open and willing to talk to you about this and to treat you. And that is as part of our job. So don't be scared.
Yeah. And when you come to me and I ask you, hey, did you want to get any STD testing? I'm not judging you. I'm just asking if you want to get it done because it's truly so easy for me to do that while you're there for your annual exam. Okay.
All right.
All right. Thank you, ladies. I hope you enjoyed this episode and you learned something. So looking forward to next week's too.
You know, it's going to be episode 13. Lucky 13. Here we come.
Coming in hot.
Maybe we should hashtag Taylor Swift and then maybe we can get her as a listener.
Okay. Yeah. I say we go for it. You know, what do we got to lose?
Literally nothing.
Literally nothing.
Yeah. Okay,
let's
great.
do it.
Okay. Bye.
Bye.
The information provided in this podcast is for general informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts, guests, and producers of the podcast do not assume any liability for the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk.